things that they are prescribed would be a little bit different than, say, their counterparts for men. One thing we run into very often is a woman who may have risk factors comes into our office and we perform a regular treadmill stress test. And in men, that is not a perfect test, but it's relatively sensitive for picking up people or men who have coronary disease. For women, it's actually, in some studies, it's very very poor test because nobody knows why, but some people think that estrogen interferes with EKG and causes false positive and false negatives. And so it becomes a little bit more diagnostically challenging because of the gender nuance. Nobody knows exactly why, but that's the theory.
And does that make it all that much more important for women if they see any signs or symptoms or to get that regular checkup? Does that make it all that more important because there are those differences?
Sure. Yeah, I would say that it's interesting. Women are more likely to go see their primary care doctors. They're less likely to go see a specialist. And I think that's women are more likely to be preventative, but when they have issues, they have so much going on usually in their lives, they're less likely to go seek out additional care, or they tend to blow off symptoms. And also, men have symptoms of chest pressure, crushing, radiating to their necks, their jaw, to their arm. And women have different symptoms from what we understand. They'll have symptoms that are a little more nondescript, at least in the way that it's maybe the same symptom, but they describe it differently, or it has different nuance, more nausea, for example, or more epigastric discomfort, which is the area right below your sternal bone, right, your chest bone, as opposed to that crushing, pressure that men tend to have. And I think that the cardiac community is becoming more aware of the nuances between men and women, but the data would indicate that there's still a lot of room to grow.
Well, it sounds like some of those general symptoms could be confused for other things too. You know, if you've got heartburn and you maybe just blow that off as something else and not really consider that as a cardiac condition.
Exactly. I mean, don't misunderstand me. I mean, men do it too.
Yeah.
A lot of times people say, well, how long have you been having pain? Well, I haven't had pain, doctor, but I've had heartburn for 7 days straight.
Yeah.
Oh, well, that's actually your heart. But for one reason or another, I don't think anyone will ever know, women's symptoms tend to be a little bit less classic. And I think that's more of a bias related to where the research is. It was mostly done in men, and so that's how we are taught, and that's how we're trained to hone in.
Yeah.
Certainly studies show that tests, it becomes a little more difficult when one way to make a treadmill test more sensitive is to add imaging. And the most common imaging, the most sensitive imaging that we have is a nuclear test. So you do the treadmill test and then you do the nuclear test. The problem is, especially in young women, the nuclear test is an exposure to radiation. So now you have to concern yourself, or you should concern yourself with, theoretically and in actuality, increasing your breast cancer risk. And when the heart sits right below the breast and you're getting a lot of radiation dose there, it's something you should think about. And I think it's hard to sort of walk that fine line because you certainly don't want to hurt anybody. And cardiologists, we do our best to try to figure out it's what we call a pretest probability, where we say, yeah, I think it is coronary disease, or no, it's probably not. And then choose a test that will help us get there. Yeah, having said that, the magic 8 ball is only so good.
Yeah, yeah.
And so we get surprised from time to time. And also, it's interesting, I think that women are less likely to participate in research. They're usually a lot more, and this is slamming men, so forgive me on men, but they're usually more thoughtful. Men are sort of like yes or no with research. I'll sign. If you think I need to do it, I'll do it. Women are much more, well, tell me all the nuances, tell me all the possibilities, tell me any of the downsides. And so I think they're less likely to enroll in research compared to men. And I also think that they're more likely to opt out later on if things aren't going well. They don't, it's not that they don't tough it out, they just, I don't want to do this anymore. I've got so much going on, do I really need to worry about the extra nuance with research and the extra problems you could have? So, and that's what happens, unfortunately.
Sure. And just to remind anybody that might be joining us just a few minutes late, we're talking heart health with Dr. Phillip Anderson. He's a Florida Hospital Cardiologist. And we just have some generic questions. We welcome you to submit your questions as well through Florida Hospital's Facebook page or a live stream. We'd love to take your questions, and Dr. Anderson will do his best to give us some insight on a variety of issues. And one that's kind of common with a lot of people is cholesterol. People worry a lot about cholesterol, and people have worried about, does it come in through your diet, or how is cholesterol impact their life? Tell me a little bit about cholesterol, and I know there's good and bad and all of that.
Yeah, that's a good topic. I mean, that's what a lot of people in the modern cardiology era believe is the driving force for causing heart attacks, strokes, most cardiovascular problems, peripheral vascular disease. So it becomes a very important thing to worry about in terms of preventing those things in the future. The issue comes down to cholesterol is a very complex biochemical aspect in our body, and we do get it in many ways. It's an important molecule that we use in our cells, and we use it for energy. We use it for a lot of important parts of what we do. So it's not purely evil as you would believe. The issue with cholesterol is the total cholesterol is important, but the cholesterol that I tell my patients to worry about is the bad cholesterol, the LDL. And to keep it easy, LDL needs to be low. The L needs to be low. And if you have problems with diabetes or you have known coronary disease, your LDL needs to be less than 70. If you have problems with family history, or I think you're greater than 50, but don't have any problems with with these actively coronary disease or diabetes, then probably an LDL less than 100. But it's interesting because there are populations in very small, sort of secluded islands in the Pacific Rim. I can't remember the name of the actual island off the top of my head. I'm sorry. But it's a little bit. They have other health problems, but one of the things that they don't have is a high cholesterol, and nobody on that island has coronary disease or strokes.
Yeah.
They die of other diseases, cancers, but all of their LDLs are around 50.
Wow.
And when you're a child and you're growing, your LDL is 50. And kids don't have cholesterol buildup. If you take autopsy studies of kids and men of all ages who died from other reasons, and you look for the amount of plaque burden, there's an incremental growth, and clearly after we hit puberty, the LDL level starts to rise. And I think there are a lot of people who feel, and there's some good data to support, that if you can drop the LDL below a certain level, you could prevent and maybe even regress the progression of coronary disease.
Yeah.
So it's an important thing to worry about. It's probably one of the most important things, and my bias is that it's one of the things that, in generations before us it was IV fluids, then it became antibiotics, then it was the ventilator, but this is going to prevent more coronary disease, prevent more strokes. It's going to help people live longer, and it's going to, in the hindsight, it's going to look to have reduced cardiovascular disease significantly moving forward.
What are the best ways to get that bad cholesterol lower?
Right. It's a great question. So the best way is diet and exercise, specifically exercise. I think that our diet is, you're asking about, do we get cholesterol in our diet? Of course we do. Everybody knows that having the big juicy steak at any of your big steakhouses is probably not particularly good for you. Instead, really, a lot of cardiologists recommend Mediterranean-style diets or variations of that. And basically that means that you should choose fish over any meat if you can, and then white meats, chicken, turkey, and then white pork, actually, as long as it's trimmed, is pretty healthy for you. And then moving down to your red meats. And look, I'd be lying to you if I said I never had a steak ever.
Yeah.
But you certainly, have to try to minimize as much as possible. Be thoughtful. And then the other aspects are fresh fruits and vegetables, lots of good hearty vegetables you make yourself, and then using olive oil, or vegetable oil specifically, but the best one really is olive oil. And that's because the oil that's in fish and the oil that comes from vegetable is less likely to be as aggressively absorbed into the arteries when you take it in. The nuance of that, actually, it gets a little bit more complex, because the bad cholesterol, to be a little bit more nuanced, if you have 100 for your bad cholesterol, which would be good, but you have a lot of small particles, which are the aggressive kind, you are the same kind of risk of somebody who has a cholesterol of 150,
wow,
but has a lot of bad small particles. So if you get your LDL to goal and you still have problems, or if you have a bad family history, that would be something that I think might be worth looking into.
Yeah.
I'm getting off target. So diet is a good way. My bias is the most important thing to do is exercise.
Yeah.
And when I say exercise, I don't mean get to the gym 3 times a week. The AHA actually has recommendations for that. But the more we look into it, I mean, if you look at the difference between Europe and the United States, in the United States, we drive everywhere.
Yeah.
In Europe, they walk everywhere, and there was a nice journal article in Lancet, which is a very good article from Europe, and they looked at people who exercised by walking 15 minutes, whether they had to or not, versus people who did the AHA recommendation of 30 minutes 3 times a week,
Right.
and just walking 15 minutes every day gives you lower strokes and heart attacks
Wow.
and cardiovascular death.
So it's not rush out by the gym membership. It's just
Absolutely
incorporated into your life.
Yeah.
How many times have you heard before, park at the back of the parking lot and walk in,
exactly.
and those kind of things. So it really, what you're saying is those things do add up.
Yeah, I mean, what I tell my patients is that, a lot of us have a lunch break of 30 minutes or an hour, and a lot of times we go from a sitting job to sitting down to have lunch.
Yeah.
And truthfully, we snack when we're working.
Yeah.
There's no reason why we have to sit during a lunch hour.
Yeah.
Go find a trailer around a lake, walk for 15 minutes if you don't feel like getting into it. Walk for a half hour if you feel good.
Yeah.
And that's to getting to the math of all that. If you walk for 15 minutes, which is about a mile, that's 100 calories.
Yeah.
That's a rough estimate. That's pretty much holds true for everybody. And 100 calories just once a day for 365 days a year is 36,000 calories. That's about 9 pounds of fat that you either didn't put on, or you took off.
Sure.
And so that adds up. I mean, nobody gets large overnight. It definitely takes years, and it takes years to get off.
Yeah.
And if you make a quick little lifestyle change, it can make huge gains in your health moving forward.
Absolutely.
Yeah.
We've been talking with Dr. Phillip Anderson. He's a Florida Hospital Cardiologist. We're taking general cardiology questions, and we welcome you to do the same. I want to take a couple questions. I know we have one here. We were talking about women in cardiac health. What's the #1 recommendation for women who have a history of heart disease?
Who have a history?
Yeah.
They've had heart attacks before?
Well, kind
don't
of
know.
working
We don't
on,
know.
we don't have that much specific information, but if there's a family history maybe or something like that, does that play into a woman's cardiac health?
Sure. Yeah. I mean, obviously, at the end of the day, all of us can only look into the mirror and say, what have we done to prevent it? We know that, for example, in the question of family history, I think being aggressive about risk factors, which include blood pressure, cholesterol, diabetes, if your family history is very aggressive and you have a lot of early being people having heart attacks in their 40s, then I would say you would be very wise to make sure that you're exercising every day, that you are very careful with your diet, and seeing your primary doctor regularly, and maybe even visiting with a cardiologist one time to see if you're worried about any kind of symptoms, to come in and be seen. It's interesting. I mean, we've all seen those drug cholesterol commercials where the guy exercises like crazy and he eats well and he still has a high cholesterol and has a heart attack. And we all know of people, when we really think about it, who die suddenly. Most of those are from heart disease, and they were people who took good care of themselves. So our family history does play an aggressive role. Now, as far as parceling out women versus men, really, in general, a lot of the recommendations are the same. And the medications that we use do a lot of good for prevention. Now, if you already have coronary disease, there are a lot of things that you can do to prevent further progression. but it is just being very aggressive about all the things that you should be doing anyway. And make sure you take your medications. Depending on the kind of disease, the medications do play an important role in either stabilizing the disease you have, or maybe, if not regressing them, certainly keeping everything sort of at bay for a while. A lot of people come in and they take care of themselves and they have heart disease in their 70s, and they kind of get disappointed like they didn't do anything. And I always tell them that, look, like if you remember what I said at the beginning of this cast, that people, if you look at autopsy studies, they're going to have progression. We haven't been able to stop it altogether. But if you show up in your 70s and you hadn't taken care of yourself, you probably would have been in to see me in your 50s. Yeah, so that's a good example of people who do take good care of themselves. And I think that there are a lot you can do, and all you can't choose your family, and so you get what you get, and the best you can do is sort of exercise, and I mean that's true in all aspects, right? Not just heart health, but certainly you do the best you can, and if you're exercising and you're eating right, and you can really look yourself in the mirror and say, I've done everything that I can do, then the future holds what it holds, and that's the most important thing. Women, actually, I should say, one of the things that does go under-recognized, women have a lower, but premenopausal women do have a lower event rate than postmenopausal women. And it's actually, that kind of goes into the aspect of we don't understand why, especially in the setting of the abnormal stress testing I was mentioning before. But women, their rates of having disease really pops up after menopause or menopause for another reason. And so, if you're postmenopausal, I would, seriously think about visiting with your doc and making sure everything's together. And if you have aggressive family history, especially on the women's side, that's something you should be on top of.
One thing that everybody seems to talk about too, that's cholesterol and blood pressure. People worry about the blood pressure. Is it too high? Is it too low? And there's all kinds of blood pressure medications out there that people are on that, do a variety of things. What's your take? Talk about good blood pressure levels, and why do people worry about it so much?
So that's a great question. The issue with blood pressure is it is one of the mechanisms that cause stress on the heart. And so that plays many different factors. One thing that it does is it can accelerate coronary disease. You imagine that the arteries that feed the heart, which are sort of the fuel lines to the pump, they get hard over time. It accelerates inflammation, which will increase the plaque burden, which is an important thing. They do play a lot of role in terms of prevention. So if you can keep your blood pressure down, you're going to decrease stress on those heart arteries and decrease progression or at least slow the progression of coronary disease. The other aspect of it is if you have a weak heart, which is something that kind of is a very important thing that, if you imagine blood pressure being how much weight that your heart has to push to get blood forward to your body, if your heart's weak, its ability to do that is a lot less. Just like if you take someone who's very deconditioned and ask them to try to bench press, they're just not going to be able to do it, or do a push-up, for example. And so, and that's not a perfect analogy, but it's kind of a way to think of it. So the lower your blood pressure is, the better off you are, and the easier it is your heart can do more with less. And that's a fine line we run all the time. Now, if you don't have coronary disease or don't have a weak heart, our target blood pressure is around 120 over 60 or 70. And certainly if it starts getting 135, definitely over 140, then it's time to think about starting to treat. On the other hand, if you have a weak heart, we try to drive it even lower, really around 100 over 50, 100 over 60. And the upper number becomes very paramount to try to help you moving forward. Obviously, there's a fine line, because as you drop people's blood pressure, sometimes they can get symptomatic, and that becomes a very difficult challenge we deal with, trying to get you the right medications to help your heart, to help your body, really, because it has impacts on your kidneys and a few other on your stroke risk, etc. But certainly that is something that people need to be worried about, and that's something that any when you go to any doctor's office, they're checking your blood pressure. One of my old teachers used to say that You know, if you could be on a desert island and you only had one tool to be able to take care of a population, what would it be? And the answer is the blood pressure cuff.
Really?
Because
wow.
if you can get people's blood pressure down, you're going to keep them alive a lot longer than if you'd have no idea what their blood pressure is.
Right.
So.
Now, there's also issues with your blood pressure being too low. And
Sure.
I know that that's not probably the majority of the population, but it does happen to some folks.
Right, sure. Well, that can cause you to get lightheaded. It can cause you to pass out.
Yeah.
It certainly is something that is difficult, and there are some people who have inappropriate drops in blood pressure. Our body's constantly in this ebb and flow between rest and relax and fight and flight. You know, if you are getting chased by a cheetah, you got to try to get out of there. If, on the other hand, if you know your post-Thanksgiving dinner, you're not going to be able to do that, right? So,
right.
I think. You know, what happens in some people is their rest and relax inappropriately gets sort of upregulated, so to speak, or flushes their whole body, and then they think they can pass out. They can feel very, very terrible. The best thing you can do when that happens is just lay down and let it pass.
Yeah.
If you hear people passing out from the sight of blood or passing out after they go to the bathroom, that's usually the cause. Obviously, if you pass out at all, you need to see a doc because there's a lot of bad things that can cause passing out. And if your blood pressure is too low, you could either be over-medicated or certainly there are actually symptoms where people just have poor ability to control their blood pressure. There are actually medications that can raise your blood pressure after a lot of the other causes have been sort of eliminated.
Yeah.
So I would, you know, if your blood pressure is running too low, now it's just a number.
Yeah.
When it's all said and done. So if your blood pressure is 90/50 and you're a young person and you feel great, then you're fine.
Yeah.
And that goes with anybody, really. If your blood pressure is low and you feel well, don't worry about it. If your blood pressure is low and you feel terrible, you feel fatigued, you can't get around, you feel lightheaded every time you stand up or get out of bed, that's something you need to probably be seen for.
Yeah. We're talking to, in case you're just joining us a little bit late, we're talking to Dr. Phillip Anderson. He's a Florida hospital cardiologist, and we're taking some general cardiology questions today, and we'd love for you to join the conversation as well. I do have one question that's coming in here from Marie. Should I see a registered dietitian or a qualified nutritionist to learn about healthy eating? So you can talk about that from a heart perspective, I'm sure.
Well, certainly if someone's had a heart attack, one of our favorite tools is a cardiac rehab program. And the reason that plays an important role is it gives you all kinds of education, not just on are you safe to exercise, how much can you exercise, how severe has your heart attack been, but they also do classes for education. Usually those are run by dietitians. So the major question to that answer is yes, it's certainly not a bad idea. For people who don't have the time or don't want to afford to do that, believe it or not, the internet is a wonderful tool. And just by me saying Mediterranean diet, I think if you went online and found Mediterranean style recipes, you would be doing a lot. There's a lot of good cardiac healthy cookbooks out there. I know one called the Heart Healthy Cookbook is a very good one out there. Actually, it was up for an award a couple years ago, and it was actually kind of a total side note, sorry, but the book was written by one of the premier rehab specialists for cardiac medicine, and he went to New York it was a sort of newcomer cookbook for general population, and it was awarded at the Foodie Awards down in New York. I don't know what they're called. Yeah. And he lost out to somebody whose topic was how to cook with fat every different way. So it was sort of I feel like he felt like he was in the twilight zone.
Yeah, I know, right? Set up there.
But yeah, there's a lot of tools, and if you really have the time and the question, certainly is a good idea to discuss with a dietitian. Moving back to the idea of diet, you know, I always bring up the point is it's really about calories as much as it's about diet, and we underestimate that. If you take somebody who, maybe not Panera is a good example, but goes to California Pizza Kitchen and orders the large salad every day, versus somebody who goes to McDonald's and has the Happy Meal, who's going to have a better health? And it is arguable, and I wouldn't say that I'm totally right, but I can tell you that the person eating the salad is going to be fatter, because the amount of calories in that salad is twice what you get in a Happy Meal. And back when, you know, obviously my grandfather, when McDonald's came out, that was the size of a standard hamburger. So clearly we've expanded our diet incrementally, and that's playing as big a role as anything else in terms of obesity and heart disease.
We talked a little while ago about women in heart health and moms and being stressed, women and being stressed. What are some of the ways? We just got another question on the web about what is the best way to deal with stress when it goes, you know, happens with your heart, because stress is, for many of us, just a part of life as one with small children.
Right, yeah, me too. So the best answer to that is to find time for yourself, and it doesn't have to be long, 15 minutes, 30 minutes, and that time can be spent doing things like time at the spa or time in a bath. Those things are good stress relievers, just relaxating. Honestly, exercise is the best physiologic stress reliever. So like I said before, spending 15, 30 minutes just going for a walk, taking yourself out of the stressful time. Usually people with small children, they're riding in strollers, they're more than happy to go for a walk. It's a good thing to teach them to do, especially when we're all worried about children with obesity. It's becoming more prevalent. If you're going for a walk, they may pick that up as a habit, and there we are keeping up with the Europeans because it becomes part of our lifestyle. It's not an exercise. I mean, I'm not telling people to go out and buy a gym membership, because I've been there. You go buy the gym membership and then nothing happens. It sits on your shelf for the year and then it's expired. And also buying equipment, you use it for 3 months and then it sits there and it becomes a clothes hanger, unless you're really motivated. Now, some people don't like to walk outside, obviously, in the terrible summers. So getting a temporary membership that's when I would say a gym becomes valuable.
But you also have things like malls are air conditioned. You know, I know a lot of seniors like to get around the mall
totally
and walk.
Right.
So there's
anywhere you can find. I mean, and then. You know, the idea is, I try to tell my patients that you want to try to enjoy it at some point. It becomes part of your lifestyle. It becomes that stress reliever that, you know, you actually look forward to doing. And that's an important part of it. If you don't look forward to doing it, then you won't. But, you know, people ought to ask me, what kind of exercise can I do? And holding your body weight is the best way to go. I mean, you go to a gym and you see people on the treadmill, they're doing more, but they're not doing as much as people who are actually running, but it's still very good. And then people on the elliptical machine, they're doing something. It's not, any exercise is better than no exercise, but to do 15 minutes of walking on a treadmill or outside, you probably have to do 30 minutes on the elliptical. And then cycling, while it's very good exercise, especially if you go to those cycling classes, but if you're just doing cycling at your own pace, you really probably have to cycle for an hour to get the same kind of cardiovascular work. And to really work your heart, you really need to carry your body weight. So if people ask me if they can walk and they have the joints and they have the capacity to do it, I tell them, you know, try to just go for a walk. And some days it can be a fast walk, and some days it can be a, hey, you want to go for a walk? Let's walk and talk and de-stress and complain about our boss or complain about, you know, somebody at the, you know, the luncheon who made a snide remark or something, you know, and that becomes good stress relief, but also you're exercising, and it does everything at once.
Fantastic.
A little utopian, I guess, but you know, we're all busy.
Yeah, absolutely. Lots of great information. Thank you so much for making the time for us, Dr. Phillip Anderson, joining us today. And thank you to everyone in the audience for submitting questions. They're great. We're going to continue to have these type of web chat forums, so please continue to watch Florida Hospital's Facebook page. We'll continue to give you updates about when these chats are going to be happening, so stay with us to do that. And then also, if you'd like, if something that we talked about today triggered an idea, something that you thought you might need to see a cardiologist, you're welcome. We have a phone number for you to call if you'd like to make an appointment with Dr. Anderson or with another Florida hospital physician. That number is really easy to remember. It's 407-303-DOCS. So that's an easy one to make. So if you'd like to make an appointment, you can do that. If you're also interested in more information about general cardiovascular health or other procedures, you can visit the Florida Hospital Cardiovascular Institute website. That website is www.flheart.org. There's a lot of general information about different kind of cardiac procedures, so if you'd like to learn some more, you can always visit that. And then, of course, if you're looking for general health and wellness information, visit us at Florida Hospital's Healthy 100 website. That's www.healthy100.org. And again, thanks so much to Dr. Anderson for joining us, for submitting your questions. Please check in with us on Facebook so we can continue to share this great health information with you over the lunch hour. Thanks so much. I'm Jennifer Roberts. Have a great afternoon.